Thanks, you Holt. Another quick THCB update here. This is Amy Parekh. She is the Chief Medical Officer of Included Health, which used to be more famous some time ago as Grand Rounds and Doctor on Demand, then bought a company called Included Health and changed the whole name for reasons that escape me. But Amy, perhaps you'll tell us about that. But been around a while now. I think Owen started Grand Rounds, what, 2010, 2011?
Yep.
So we're back there.
Good memory.
Doing a lot of different things. Starting with navigation, but doing more. So explain to me, what is Included Health doing now?
Yeah, so for those of you who don't know, as Matthew said, we are the combination of Grand Rounds and Doctor on Demand and Included Health. And our mission is to raise the standard of healthcare for everyone. And the reason we're called Included Health is because we believe everything should be included in healthcare. You don't want to go to 15 different places. You want to go to one trusted source to get what you need in healthcare. So what do? We do navigation. So when you're looking for a primary care doctor or a specialist and want to know who's the best match for you, who is high quality and in your network, you come to us. When you have a question about a bill, you come to us. When you need more help because you're pregnant and have a child in the NICU, you come to us. And when you need primary care, behavioral health, 24/7 urgent care, guess where you go? You come to us. So we're the phone number on the back of people's insurance cards. We're often placed in patients' employers for their benefits. But really the point is, when you have a healthcare problem, just start with us first and we will get you where you need to go.
All right, so distribution, right? There are health plans, there are large employers. I know you've been working with that and working through that over the years. Obviously, you're not the only people doing this, but it's actually something which is a frightfully small number of people have access to, in my humble opinion. So give me a sense about where you are in the distribution journey with some employers, plans, and others.
So I agree with you that too few people have access to navigation services and things like virtual care. For navigation, about 10 million Americans have access to our services now, which is great. We are the largest navigator outside of the traditional carriers at this point. And over about 50 million people have access to our virtual care services. So a lot of people do have access. I agree with you. It's still too small. Who has access to our services? Mostly large self-insured employers purchase our navigation services. So think about that, like the Walmarts of the world, the AT&Ts of the world. Those are folks who were on with us at the health stage. Those are our clients primarily. Health plans also do buy our services, but mostly on the virtual care side. They buy us for virtual primary care, behavioral health, and urgent care to supplement their network of in-person providers. So that's usually who has access to it, mostly commercial lives at this point. So we don't yet have a very large Medicare or Medicaid base, but actually some Medicare Advantage plans use us as well for virtual care.
So let me poke you on part of that, and I'll try to make it so you don't have to insult your clients on the virtual care side too much. Health plans are pretty bad at this stuff, speaking by personal experience. Some of them try to do it internally, but don't do it very well. And then there's a whole bunch of people who are in small employers buying on the exchange. You mentioned Medicaid, Medicare, who we spend a lot of money unnecessarily on a lot of things for that, which, you can tell me a bit about the cost outcomes in a second. But why has it been so tough to get more of this type of navigation into those types of organizations?
Yeah, I'm not in those organizations, but I agree with you. And I was actually just on with a health plan executive earlier this week where, I think there is acknowledgement that they have wanted to do these things well for a long time. And honestly, probably companies like ours on the navigation side might not exist if they had done a great job of serving their patients really well.
Sure enough, yes.
Over the last 50 years. And they are, one good thing I would say is I do think we have raised the standard. I think navigators have raised the standard of what you expect from your carrier. And so they are starting to make investments in these things. We are very open to partnering with them. If there are health plans who want to say, hey, we want to hand over the navigation part to you, we're ready and willing to partner. We want more people to have these services, but it does take time and a commitment to willing to do something different. Change is hard.
All right, so I want to talk about two things. One is, and we can go in either order, but let me start with the obvious one. You go to an employer, right? And you say, we're going to make your employee's life lovely and wonderful. That might be good, but they might also be asking about how much it's going to cost them and if this is going to save them any money. So what are your outcomes so far in that area?
Yeah, the good news is we actually have external validation on savings. So we did look at, if you buy the entire package from us, we will save you money on your trend. So I'm sure everyone who listens to your blog knows this, but healthcare costs kind of go up every year. This is going to be a big year, right? People are looking at high single digits, sometimes low double-digit raises in their healthcare costs. And we say we can bring that down by about 2%, and we have external validation on that methodology from Validation Institute and from Alveolar Consulting. So that helps our clients understand that, yes, we're going to make their population healthier. We are here for outcomes, and they're going to be able to do that in a more sustainable cost ecosystem over time.
All right. So now I am an employee at Walmart, AT&T, whatever, one of your members, and I think I have either, a weird thing going on, or I go to my primary care doc and they tell me I have cancer. What is the typical experience now? What happens next?
Yeah, so one of the things, a lot of people like to talk about the front door in healthcare. We actually don't. We just want to say, come to us and we will figure out how to get you what you need. So let's use both of those examples. Let's say you have a new diagnosis of cancer. You will want to know, how do I get into an oncologist? What's a good cancer center? Maybe I need an expert medical opinion. You just could call the phone number on the back of the card. Or if you're like me and you hate talking to people on the phone, you go in the app and you start chatting. You probably message being like, hey, I'm Amy, I need help. And a care coordinator will get back to you within 2 minutes and have a conversation with you. And if they think you need to talk to a clinician, they'll say, are you okay if a clinician calls you? That clinician will call you and do an intake for whatever the service is needed. Let's say it's a behavioral health thing. So on the maybe a different end of the spectrum, you actually call in because you have a claim. You have a bill that you can't pay, and we notice that because it's an out-of-network behavioral health provider. That happens to a lot of people. You message us and you're like, I'm really struggling with this bill, and we could say, well, do you want to actually just talk to a therapist in the next 7 days? Let's set you up with an appointment. But maybe you know what you want. Maybe you don't want to talk to anyone and you're just like, I need to see an oncologist. You can just go in the app, type in oncologist, and see the best matched oncologist for you. So those are all the different ways you can come in, and wherever you come in, we will then help you take it from there.
All right. So how does that mean you work with, either local or national networks of, say, oncologists or specialists like that?
Yeah, we have some relationships with large health systems, mostly around our expert medical opinions. Yep. So if you remember when Owen started the company, It was actually about expert medical opinion, even pre-navigation. So we were very lucky to have relationships with over 35 top healthcare systems across the country. And we're always building those out. But mostly, if we're not using one of those, it's just we know your network because we get all the data from the employer or the health plan, so we know who's in your network, and we use data science. And I know at this conference everyone's talking about AI. We were talking about AI in 2010.
You've been trying this data science for a while.
We've been talking about it for a very long time, and we use data science to match you to the right in-network. So we don't really need a relationship with that provider. We just need their data so that we can make sure that they're the best match for you.
All right, last thing, Amy, what new programs you got?
Yeah, so you asked me about how we save money for clients. And I actually think the interesting thing is there are a lot of people who have great metrics on that. But Matt, if I asked you, how do you know that you are actually making the population healthier? I think most people would give you a blank stare. Mm-hmm. Maybe they're going to talk to you about hemoglobin A1C scores for diabetics. Maybe they'll talk to you about hypertension control for hypertensive patients. But how do we actually know all of this stuff we are doing in healthcare is making people healthier at the highest level? So one of the things we're really proud of is we came up with a metric. It's actually a CDC metric. We didn't come up with it, but we studied it and really believe it is our true north metric. It's called Healthy Days. It's very simple. We ask our patients at registration and every 90 days after, in the last 30 days, how many were you not healthy? We subtract that by 30, it comes up with a number. If somebody says more than 15 unhealthy days, we offer them a phone call with a clinician. A clinician calls them. They can spend as much time as they like. They actually, on average, spend 20 to 30 minutes. It's an open-ended conversation to figure out what is causing all of those unhealthy days. For some people, it's super easy. They hurt their knee last week, and that's why they're not feeling healthy. For others, it's more complex. It's something about some depression. It's something going on with their kid. Maybe they have diabetes also, and we get them on a path to more healthy days. And what we are now able to show after piloting this with many of those clients we talked about, those self-insured employers, is that we can actually make people's healthy days better. We can actually give people back 2 healthy days that they can do what they want with. Maybe it's more work. That's pretty rare from a survey we did, but maybe it's spending time with their kids. Maybe it's investing in their own health to keep the cycle going of more health over time. So we're really excited about it, and I hope everyone holds them to a standard like that, because we all know what to measure when we're talking about costs. We should know what we want to measure when we're talking about health.
That's great. All right, we're talking with Amy Parekh. She is the Chief Medical Officer of Included Health. Amy, thanks for your time.
Thank you.
Bye.